everyone. I have an introductory statement to make before we begin the public hearing. This public hearing is to discuss proposed tobacco control regulations for the town of Shrewsbury. Copies of the proposal have been made available at the Board of Health at the Richard D. County Municipal Office Building, 100 Maple Avenue, Shrewsbury, Mass. 01545. The Town of Shrewsbury Board of Health is a 3-member board. The purpose of the board is to promote and protect the public health for the citizens of the town of Shrewsbury. They derive their authority from the Massachusetts legislature. The members are Stephen Vigent, myself, Jenny Fishman, and Dr. George Abraham. The City of Worcester Division of Public Health is the health agent for the town of Shrewsbury, a member of the Central Mass Regional Public Health Alliance. The duties of a health agent are to carry out the wishes of the board, assist in the enforcement of their regulations, and deal with the day-to-day operations of the Board of Health. It is uncommon for the Board of Health to hold public hearings on proposals before them. Even though all proposals are dealt with at meetings to which the public is always invited, however, because of the broad interest in tobacco control, every effort has been made to provide a public forum for the exchange of ideas and views. As the purpose of the public hearing is to collect information and opinions, the board will not ask for a vote from the audience, nor will the board itself vote on the proposal at this public hearing. The board will announce the meeting date to which they will discuss and vote on the proposal. This meeting will be public. However, the board will not provide time for further public testimony unless a board member has a specific question to which an audience member can offer some clarification. After the public hearing, the board will accept written testimony for a period of 8 days until August 28, 2021. Letters can be mailed to the Board of Health at the Richard D. County Municipal Office Building, 100 Maple Avenue, Shrewsbury, Mass. 01545. If the proposal is passed, the approved regulation will be posted at the Board of Health office and will be publicized in summary form in the Worcester Telegram and Gazette within 1 week of passage. Welcome to the Shrewsbury Board of Health public hearing to discuss a proposal to change the tobacco regulations. We appreciate your taking the time to be here. A copy of the regulations is available at the Board of Health at the Richard D. County Municipal Office Building, 100 Maple Avenue, Shrewsbury, Mass. 01545. In the interest of time, we ask that you adhere to the following ground rules. Any person wishing to speak should sign in. Before addressing the Board of Health, you must have read the proposal. When addressing the Board of Health, you must first identify yourself by name, address, and any professional affiliation you may have that impacts your comments. Identify the section of the proposal that you wish to comment on. Please limit your comments to 2 minutes so that other members of the audience will have a chance to speak. And please be considerate of those speaking, whether you agree or disagree with them, and refrain from commenting out of turn. A written public comment period for those who are unable to attend or do not wish to testify at the public hearing will be allowed. Written testimony will be accepted by the Board of Health until August 28, 2021. Please send comments to the Board of Health at the Richard D. County Municipal Office Building, 100 Maple Avenue, Shrewsbury, Mass. 01545. Any person showing verbal disrespect to those speaking will be asked to leave the public hearing. And thank you for your cooperation. I would now like to convene the public hearing. As I said, the purpose of this hearing is to take testimony on 5 items that the board is considering in terms of amending the regulations. The first is a cap on the number of tobacco retailer permits. Currently, Shrewsbury has a cap of 27, and the board is considering dropping it to 20 tobacco retailers. A new policy chart would better help define which fines are state or local level, and the board is considering this policy. It's also considering a ban on smoking bars, vape bars, and hookah bars. Also, an amendment to the flavor policy, adding possess, hold, or keep, which prevents tobacco retailers from keeping prohibited products in their permitted locations for illegal sales to customers they know. Also, the 5th item is to ban rolling papers and flavored rolling papers. Okay, the hearing is convened. Are there any further comments or testimony in this regard?
Good morning, my name is DJ Wilson. I'm the Tobacco Control Director at Mass Municipal Association. So I was just going to go through these 5. I'll start with the easiest ones first. We have 141 cities and towns that have, out of 351, that have capped the number of permits they issue, and we've had dozens go back and rejig that number, lower it, as the years have gone past. In part because we now have literally no vending machines statewide. Pharmacies cannot sell tobacco and vape products. And frankly, we have a number of stores that have given up the sale of tobacco or vape products because they've been caught several times selling to minors, or they just have given up because it's easier to do. So that's not uncommon. The new policy chart, there were a lot of changes done to the state laws in 2018 and 2019. So this just makes it easier for retailers to understand that which policy, if they violate which policy, which level of fine they get. The state fines, which are mandated, are $1,000, $2,000, and $5,000 for first, second, and third offense, while local fines can be anything the city or town chooses, as long as they don't go under $100, $200, and $300. And most cities and towns do choose to have that $100, $200, $300 graduated fining scheme. Amending the flavor policy to add possess, hold, keep. There is a section in the new state law that does allow for mail order products to be sold to out-of-state consumers. We have found that a number of retailers are using that as an excuse to keep prohibited product in their back room or other places, and then selling it to customers they know. This is an unlikely source for retailers to avail themselves of, as Massachusetts is a high taxes on tobacco products. For cigarettes, we are like 4th to 6th most expensive place in the state. And so so it's unlikely that it happens. So this just clarifies that they can't keep product in their store, a prohibited product. Banning smoking bars. We have 138 cities and towns that have done that, and so there are only 25 statewide. I just looked at the list that the Department of Revenue keeps, because they are the ones who give out the license, and that has stayed steady for a while. One of the reasons it's a good thing to ban them if you have none, and Shrewsbury has none, is that it then upsets the apple cart. We have a level playing field where all restaurants and bars in Shrewsbury cannot have smoking. So to allow to have a smoking bar enter a city or town means that the restaurant bar community does not like that, because it seems that they've now broken that level playing field. And so in a number of places, the smoking bars have opened up in multi-use buildings. So then there's smoking happening in a building where other businesses or maybe even other residents exist. So we do believe that's a good thing to do. And lastly, cities and towns have been prohibited for a very long time from doing anything about rolling papers. Like easy, wider, plain paper, rolling papers. This is what we're talking about here. And but that got changed in the last update by the legislature, so cities and towns can now do something. So it is now up to the town of Shrewsbury can avail themselves of this new opportunity and decide to either ban rolling papers altogether in all stores, or they could just amend the flavor policy and add that flavored rolling papers can't be sold. So one thing that was interesting with the state law is nowhere in state law was there a definition for a rolling paper. So I did develop a definition from what other states have been doing, and then offer the ways to the policy if you were to add a ban to that, or to want to add that flavored rolling papers couldn't be sold in Shrewsbury. The reason that I would say that the flavor one kind of makes more sense is that one of the reasons that we have the flavor policy in the state of Massachusetts, and then we had previously many cities and towns that had it locally, is because youth are attracted to flavors. So we don't want kids getting flavored rolling papers and that be the route that they use their own rolled cigarettes to start a lifetime of nicotine addiction. So that is the public health rationale. I'll leave this behind with Kerry, the options for rolling papers. Thank you very much.
Great, thank you, DJ. Is there anyone else who would like to provide testimony, either in person or by telephone?
Mr. Chair, may I ask one question?
Sure, absolutely.
Thank you very much.
TJ, is it your recommendation that we should ban all rolling papers or just flavored rolling papers?
I think the flavor one makes more sense. It's in line with the flavor policy. It's in line with the public health rationale.
Thank you.
Okay. Any other questions from the board? Jenny Fishman?
No, that's fine, thank you.
Okay, hearing, oh, excuse me, would you like to speak?
Yes, my name is Jean Moss.
Oh, could you come up to the microphone, please? Give us your name and affiliation.
Okay, Jehan Wasif, I'm the owner of the 7-Eleven.
Okay?
I'm just wondering, we're talking about flavor rolling paper. We don't have any rolling paper long time ago. It's been banned even before the flavor was banned. And the regular rolling paper doesn't have any effect on anything. And just to let you know, either when you banned everything, customers still get all the product online. So I still have all the customers come to the store to buy the grocery and telling me that we get everything online. So you banned it from the town, but they still get it online. So no matter what, they get the product. This is something has to be disconnected everywhere, not only in the stores, because they get it anyway. So this is just my concern. But we don't have, there is no flavor, and even the company, the vendors, they don't ship any of these product to the stores. Thank you.
Okay, thank you very much. Okay, if there's no other testimony being offered, do I have a motion to adjourn the public hearing?
Also moved.
Do I have a second?
Second.
Okay, all in favor signify by saying aye. Jenny Fishman?
Aye.
Dr. Abraham?
Aye.
Myself, aye. So the meeting is now adjourned. And I will call to order the regular Board of Health meeting. The first item on the agenda is review and approval of the minutes from the July 2nd, 2021 Board of Health meeting. Do I have a motion to approve?
So moved.
Do I have a second?
Second.
Okay, we have a motion and a second. All in favor signify by saying aye. Jenny Fishman?
Aye.
Dr. Abraham?
Aye.
Myself, aye. So the meeting minutes are approved. The next item is to review and discuss consideration of mandatory masking in indoor public spaces. We know that the town manager has instituted a policy for town employees to mask indoors. And we know that the school committee on Wednesday night instituted a policy requiring indoor masking for all students and staff and at least for the foreseeable future. So does the board have any desire to go any further than, let's say, being approving of these items?
I'd recommend that we concur with the school committee's recommendation.
Jenny Fishman? Yes, so I agree and approve of what the school's choosing to do, and also in municipal buildings. I do think we need something that is for all indoor public spaces in order to protect the youngest amongst us and the most vulnerable.
I think in regard to having let's say a mandatory masks in all indoor public spaces, I'm not sure that I would be agreeable to that, because as the Massachusetts Department of Public Health is not advising that, the governor is not advising that, and their main reasons are because of the high vaccination rates in Massachusetts, and Shrewsbury has a very, very high vaccination rate. And if you use the word mandatory, that implies that there's enforcement involved, and I think the enforcement aspect of this would be extremely difficult, and we would be kind of by ourselves with all surrounding towns not having this requirement. So my opinion is that there should not be a town-wide in all places like restaurants, stores, churches, and so forth, and making it mandatory.
Mr. Chair, what about strongly encourage?
I would be in favor of strongly encouraging masking in these places without having the enforcement aspect of it in place.
Agree.
What's your opinion, Jenny?
Well, as I said, I mean, you have population of children that are under the age of 12 that cannot get vaccinated and most likely won't be able to until early 2022. And I think you also have a fair amount of people that are not vaccinated that put others at risk.
Okay. In that case, then, we should probably make a motion to institute mandatory masking in all indoor public spaces and then take a vote. Do I have a motion to include a mandatory masking mandate for all indoor spaces?
A motion?
Do I have a second?
I can second it for purposes of taking a vote.
Yes, okay. So, all in favor of the motion signify by saying aye. Jenny Fishman?
Aye.
Dr. Abraham?
Nay.
Myself, no, so the motion does not pass. Given that, however, I would say that I agree with Dr. Abraham on strongly encouraging those to mask indoors. Okay.
Mr. Chair, do we need a motion about the school committee recommendation for the schools?
Yeah, it probably should. Do we have a motion for the Board of Health to be approval of the school committee masking mandate?
Make the motion.
A second?
Okay, all in favor signify by saying aye. Jenny Fishman?
Aye.
Dr. Abraham?
Aye.
Myself, aye. So the motion is passed. The next item on the agenda is to review and discuss Mask Call 3 grant requested by Jennifer Nakajoba of the CMRPHA. Good morning, Jennifer.
Good morning. Good morning, Jennifer Nakajoba from Worcester DPH. So for the last 7 years, we've been doing prevention work in Shrewsbury. For those years, we've had 2 grants, SABC and MOBC, so Substance Abuse Prevention Collaborative and the Massachusetts Opioid Abuse Prevention Collaborative. Those 2 grants ended June 30th. At that time, we applied for new funding from Mass DPH, and we got that funding, which is Mass Call 3 right now. So for the next 2-3 years, Worcester DPH will be doing prevention work in Shrewsbury in conjunction with the SCIP group in Worcester and the youth in Worcester, in Shrewsbury as well. This grant is specific to prevention among the youth around tobacco prevention use, alcohol, and marijuana. So at this point, I am reaching out to SCAPE to resume meetings, as well as in Shrewsbury as well. So I'm looking to the Board of Health to, as I start this work, I'll reach out to the Board of Health to either help me in terms of connecting me with gatekeepers in Shrewsbury who could help me move this work forward. So yeah, that's about it.
Okay.
Yeah.
Thank you very much, Jennifer. Any questions from the board?
None.
No, I don't. Well, thank you, Jennifer.
Thanks, Jen.
Thank you.
Okay, the next item on the agenda is review and act on possibly drafting a letter to Governor Baker regarding potential public health impacts to the town of Shrewsbury from the Peabody Power Plant requested by Gretchen Schultz Ellison, Shrewsbury resident. And this was a request made to the board to write a letter to Governor Baker requesting an environmental impact report and health impact assessment be provided relative to this Project 2015A. It's a 55 megawatt capacity reliability resource to be constructed in Peabody, Massachusetts. So it's basically a small peaking plant that runs when the environmental or the wind and the solar resources are not reliable in order to maintain the electric grid. And the reason we are being asked is because the Selco has a stake in this power plant. And I know, Jenny, you requested this be put on the agenda. Do you have any comments?
I do. I mean, I think that in light of what the UN report has just released over the past week or so, we have to make some very hard decisions, and we have to move in a different direction than fossil fuels. And I don't think it's something that we can wait to do. And so I would strongly be in support of this letter. I think we need to make investments in other areas and not in fossil fuels.
Okay, and in looking into this project through information provided by Selco, this is a very small 55 megawatt peaking plant that's only going to run approximately 300 hours a year, which will have very, very small emissions relative to other baseload power plants. And as I understand it, the Massachusetts Department of Environmental Protection has either issued or is going to issue a plan approval for this, which means it has met all of the regulations, the air quality regulations of the state. This is it's kind of a really small, kind of a trivial source, and it's also meant to support the operation of renewable energy resources so that the grid can be maintained. So I would not be in favor of writing the letter to the governor.
I mean, the thing is, it's asking for an impact report, right, on the residents, especially in that area, and I don't see what the harm would be in that. It's just more information.
Yeah, I mean, in my opinion, I think it really is kind of overkill because it clearly has met all of the requirements for the Mass DEP, so I really don't think it's necessary.
I'll concur with you, Mr. Chair. You're the expert, not me.
Okay, if there's no further discussion from the board, do I have a motion to draft a letter to Governor Baker regarding potential public health impacts from the Peabody Power Plant?
I would motion for it.
I'll second.
Okay, all in favor signify by saying aye. Jenny Fishman?
Aye.
Dr. Abraham?
Nay.
Myself, no. So the motion does not pass. Okay. The next item is to review and discuss coronavirus COVID-19 update. And Karen, would you have any information to add?
And certainly Dr. Abraham, feel free to jump in since I know he's also dealing with this every minute like we are. So obviously the numbers are going up. I think yesterday Shrewsbury had 9 new cases. Is that
10.
right, Carrie? Certainly Worcester and some of the other towns are seeing the same. Actually, there was one day last week, Worcester had 59 new cases. Some of them are young people, and some of them are breakthrough cases. So that's why I was happy to see that the school committee is looking at everyone wearing masks. I think it just makes sense. The Worcester School Committee also voted to do that based on the recommendation of Dr. Hirsch, Dr. Castile, who's our HHS commissioner, and Dr. Jerry Gerwitz, who's our vice chair of the Worcester Board of Health. So we hope to see that happen throughout the alliance, simply because of the fact that, you know, there are a number of young people, obviously 12 and under, that are not vaccinated, don't have, they're not eligible yet, and these breakthrough cases, which is concerning. We are starting to see in Worcester some long-term care facilities, some youth programs, restaurants reporting positive cases of employees or young people. So in one instance, there was a long-term care facility that 24 individuals on a dementia floor all were positive, and all of them had been vaccinated. So this is definitely concerning. Obviously, we're getting a lot of calls about, you know, folks who are immunocompromised that are looking to figure out where they can, or get more information about getting a third dose, and then also the booster shots. So we're looking to put together a list of questions for the State Department of Public Health to kind of help us understand what the role of local public health will be in administering these vaccinations. And also, we're just continuing as an alliance to try to get as many people to get vaccinated as possible. There's obviously still a lot of people who aren't. So, we're watching the numbers. We're vaccinating everywhere that we can, even if it's just 2 or 3 people, especially people of color. So, it's tough, and we know that everybody's going to be back to school and indoors, and colder weather's coming, so definitely need to continue to be mindful about watching our distance, washing our hands, and just pay attention to what's going on and just keep trying to get people to, get vaccinated. So I think there's still more to come. We just don't have all the information, again, about next steps on boosters and all of that, but we'll continue to find that out and share that when we get it. That's all I have. I don't know if you have any specific questions.
No, I don't. Dr. Abraham, no?
No, nothing for the Karen summed it up eloquently.
Jenny Fishman, any questions?
I think she's on mute.
Is she on mute?
Jen, I think you're on mute.
I was trying to get off mute. It wasn't cooperating with me. No, I don't have any questions at this time.
Okay, thank you. And before we move on, I noticed that Dr. Sawyer and Chairman John Wensky just came in the hearing room, and just wanted to let them know that the board did vote earlier to be approving of the school committee's recommendation or policy on masking for all students and staff and teachers. So that has been, I don't know if it needs formal approval or not, but the board is approving of your policy. So thank you for coming.
Thank you. Is it possible just to say a couple of things or ask a quick question?
Sure, go ahead.
All right, should we just come up here? Is that all right?
Go ahead.
I appreciate you having us, and for those watching, I'm Joe Sawyer, the superintendent of schools, with John Wensky, chair of the school committee. And so I guess my question is just technically, have you taken up any issues around townwide piece, or is that still to come in this meeting?
Now, we did discuss a town-wide mandatory masking order, and we decided not to go with a mandatory masking order, but to, highly encourage people to mask indoors in Shrewsbury.
That's helpful, Mr. Vigil, that's helpful to know, because the question that I had is more of a technical question, would be if there had been something issued specifically by the Board of Health, and how that would align with where we are as a school district. And when we did present the other evening, certainly said to the school committee that's something we're going to continue to watch carefully, with the intent that hopefully, assuming that the cases are able to get to where they need to be, and that we're not seeing in-school transmission or a high number of cases, that we could get to a place where we can relax that at some point. But obviously, we would need to be in alignment if there were some other issue, legal piece issued by the Board of Health. So that's helpful to know. Appreciate that. I don't know, Mr. Winston, anything you wanted to add in terms of just the school committee's perspective?
Yeah, just, we obviously unanimously supported the mitigation protocols. Felt it was important to be consistent from the best practices that we learned last year. And also equally as important is to update the public at every one of our meetings on the current data as it pertains to Shrewsbury, and just continue forward to make sure we keep our students and staff safe.
Okay, thank you.
All right, appreciate it. Thank you very much. Any other questions you have for us at all about any of the protocols?
I was going to add that as a board, we said we would concur with the school committee's decision, so that way any nuances to your decision-making we would be in support of right now. And clearly, it's a dynamic decision which will change depending on numbers going up or down, as you pointed out.
We appreciate your support.
Thank you.
Excellent. Thank you very much.
Thank you for coming.
Have a good weekend.
Okay, the next item on the agenda is to review and act on the report from the Central Massachusetts Regional Public Health Alliance. Micah, do you have your report?
Sure, good morning. In the past month, we've done about 40 regular food inspections, with a total of 95. Some of the things we've been dealing with are a lot of beaver activity. So we've been addressing that as it comes along. It seems like they've been very active this year. We've had a few places around town the ponds get shut down due to high bacterial counts. We've been dealing with that as it comes along. And so far, the majority of complaints have just been nuisance complaints, but in the last couple of weeks, there has been an increase in COVID kind of returning to complaints and issues with positive staff members at businesses around town. So we're kind of seeing that trend and dealing with that as it comes along. But that is all I have this morning.
Okay, do you have anything, Karen, you'd like to add, or?
I won't go through the whole, I know there's a couple of months, I think, worth of updates in here.
July and August.
Okay, so I would just add some new information, which is great. So the governor had that contact tracing collaborative, you know, the army of people that were helping local public health make calls. And when the case count started going down, they started to diminish that, but then, surprise, we're back up. So they had, a couple of months ago, Mass DPH, I think it was a couple of months ago, released an RFR if local public health wanted to apply for some funds to hire additional staff or consultants to sort of add capacity should this come up. But of course, the numbers started going up before they could get the funding out, and it takes time to hire the right people. So the CTC program is gonna be extended, but we found out a couple of days ago that Worcester DPH, on behalf of the Alliance, was awarded $261,000 a year for 2 years, so that we can hire 3 epidemiologists to help with contact tracing, which we're thrilled. I'm a little concerned about everyone in the state sort of trying to hire the same folks, just because there's such a demand for nurses and epidemiologists. But we had, over the last year and a half, 2, we'll call them epidemiologists, but they were funded by the CDC Foundation, and they were helping Pat, Amelia, and Sandy with a lot of, just following up with people calling with questions or contact tracing or what have you, for Worcester and the Alliance, and their contract or the award ended last week. So we were thrilled to get this information, so we'll be looking to hire 3 consultants that are gonna give us a hand with just following up and just being, deepening the bench a little bit with our public health nurses. We also hired a 4th public health nurse, which is thrilling. It took a long time. The pay is not that high because it's a municipality, and there's such a huge demand. But we're bringing on a nurse by the name of Jerry Beals, and she's going to actually be the regional public health nurse, which is what Amelia was, and then she got promoted. So Amelia's been trying to fill in when she can, but so she will be starting, Jerry will be starting September 7th. So we'll be introducing her to Shrewsbury and the other towns where she can do some programming and blood pressure clinics and just sort of be more hands-on in the towns. So that's good news. And I think we may have mentioned in here that in our spare time, we're seeking National Public Health Re-Accreditation again. I can't believe it's already been 5 years. But we asked last year for a year delay just because of extension, because we just couldn't do it with COVID. It's getting a little challenging doing it now because of all the COVID response that's still happening. But we're gonna hire a consultant to help us pull that together, because it's really a full-time job putting that together. And I think we have to submit everything by March. And then the other piece is, we did get a grant also from Mass DPH. Some folks who applied, it was to create regional structures, because that's really the direction that everyone's going in. Or to do an analysis of how things are going to date. And it's been, I think, 12 years since we started this, so we thought it was a good opportunity because of COVID and everything to sort of look at how we're, delivering services, what can we do better, cost analysis, that kind of thing. So we're hoping to bring somebody on, I hope by October, to get that started as well. So lots of good stuff, lots of moving parts, but yeah, we got a lot going on, but all good stuff.
Sounds good, Karen. I just have one quick question. What is the status of the West Nile virus EEE testing of mosquitoes?
Sure, so I can actually get, Kerry and I can work with Tim from the Central Mass Mosquito Control Program exactly on what's happening, like location-wise, but they are trapping and testing results, mosquitoes, sorry. I'm only like right here. That's as far as I got. You know what that happens if it's not down here. I used the wrong words, apologies. So last week, in Worcester, there were 2 positive mosquitoes for West Nile. So they actually did spraying in the area, I think a couple of nights ago. So they let us know pretty fast, both the mosquito control program and Mass DPH, they'll let us know if there's a EEE or West Nile virus sample, and then they respond with a spraying plan. They're really on top of it. They also have an unbelievable website that has anything you could ever want to know about mosquitoes, probably, and then some. But also they have, you can request spraying, which any Shrewsbury resident could do that. It doesn't have, you don't have to wait for, this sort of situation. You can opt out of having your area sprayed or your house. And then the other thing is they have a tire program, so they'll pick up tires, which of course we know is a breeding ground if they have water in them for mosquitoes. So they have a lot of great things that they do. So if people are interested, they can go to the website and learn more about it.
Okay, great. Thank you, Karen.
You're welcome.
Any other questions from the board? No?
Nope, and thank you very much.
Sure.
Okay, so the next item on the agenda is to review the meeting schedule, and I think we're closing in on September 17th, Friday at 8 a.m.
I saw a few leaves turning orange on my way here this morning, and I had to really do a double take. It's that time of year.
So as long as that's agreeable to the entire board, then Kerry, plan on September 17th, 8 a.m., Friday.
Meeting invite has been sent.
Okay, great. Therefore, do I have a motion to adjourn?
So moved.
I'll second.
Okay, all in favor signify by saying aye. Jenny Fishman?
Aye.
Dr. Abraham?
Aye.
Myself, aye. The meeting is now adjourned. Thank you, everyone.